Artery blockages almost never appear overnight, yet they quietly build for years, slowly restricting blood flow long before a heart attack or stroke ever announces itself. Most seniors believe blocked arteries always cause dramatic chest pain, but the truth is far more dangerous and far more silent. In many cases, the body sends subtle warning signs that are easy to dismiss as aging, fatigue, or just getting older. These signals are not loud, not painful, and not urgent enough to trigger immediate concern. That is exactly why they are so dangerous after 60. You can walk daily, eat reasonably well, and still have arteries that are slowly narrowing from the inside. Your blood pressure may look acceptable, your cholesterol may seem controlled, yet circulation to the brain, heart, or legs may already be compromised. This silent narrowing increases the risk of stroke, heart attack, memory decline, and sudden falls without warning. Many seniors are shocked when scans reveal significant artery blockages they never felt coming. The damage did not happen suddenly. It happened quietly while life went on as usual. After 60, arteries become stiffer, blood flows more slowly, and the body's ability to compensate is reduced. That means subtle symptoms matter far more than they did at 40 or 50. Ignoring these signs does not make them disappear. It allows blockages to progress unnoticed. The good news is that early awareness can change outcomes dramatically. Recognizing these silent signs gives you time to act before a crisis forces action. Today, I want to share 9 quiet warning signs of artery blockages that seniors should never ignore. These are not rare symptoms. They are common experiences many people brush off every day. As we go through them, you may recognize 1 or 2 in your own life. Before we begin, tell me where you are watching from and how old you are today. And as you listen, ask yourself a simple question. Have I noticed any of these signs and have I been ignoring them? To understand what your body may already be trying to tell you, let's take a closer look at the 9 silent signs of artery blockages, starting with the ones most seniors overlook first. Signs 9. Cold feet or hands. Cold feet or hands are often one of the earliest circulation warnings that seniors dismiss as weather sensitivity or normal aging. In reality, this sensation frequently reflects reduced blood flow caused by narrowing arteries supplying the extremities. After 60, arteries lose elasticity, making it harder for warm, oxygen-rich blood to reach the hands and feet. When circulation weakens, the body prioritizes vital organs like the heart and brain over the limbs. As a result, fingers and toes are often the first areas to feel chronically cold. Many seniors notice this even in warm rooms or while wearing socks and gloves. This is not simply a comfort issue, it is a blood flow issue. Cold extremities often indicate that blood is moving more slowly through narrowed vessels. Slow-moving blood increases the risk of further vascular damage over time. Walking alone may not resolve this if the underlying arteries are already restricted. Cold hands or feet can also worsen balance and dexterity, increasing fall risk. Some people experience color changes, numbness, or tingling along with the cold sensation. These signs suggest that tissues are not receiving adequate oxygen consistently. Doctors become concerned when cold extremities persist regardless of temperature. This quiet symptom is often the first clue that artery blockages are developing silently. Signs 8. Leg heaviness or cramping when walking. Leg heaviness or cramping during walking is often dismissed as muscle weakness, joint problems, or simple aging, but it can signal reduced blood flow to the legs. This symptom occurs when narrowed arteries cannot deliver enough oxygen-rich blood to working leg muscles. After 60, even mild artery blockages can limit circulation during physical activity. As muscles demand more oxygen while walking, restricted arteries struggle to keep up. This mismatch causes discomfort, tightness, or cramping that eases with rest. Many seniors notice the pain improves when they stop walking, then returns when they start again. This pattern is a classic circulation warning, not a muscle strain. Ignoring this sign allows artery narrowing to progress further over time. Walking through the pain does not fix the underlying blood flow problem. Over time, leg muscles become weaker and more fatigued due to poor oxygen delivery. This can reduce confidence in walking and limit daily independence. Cramping may appear in calves, thighs, or hips depending on which arteries are affected. Some people mistake this for arthritis, delaying proper evaluation. Persistent leg heaviness during walking raises concern for peripheral artery disease. This silent sign often appears years before a major cardiovascular event occurs. Sign 7. Dizziness when standing up. Dizziness when standing up is often brushed off as getting up too quickly, but it can signal compromised blood flow to the brain. After 60, arteries supplying the brain may already be narrowed or stiff, reducing their ability to respond to sudden position changes. When you stand, gravity pulls blood downward, and healthy vessels adjust instantly to maintain brain circulation. Narrowed arteries struggle to compensate, causing brief drops in cerebral blood flow. This leads to lightheadedness, spinning sensations, or momentary blackouts. Many seniors experience this when rising from bed or standing after sitting quietly. The dizziness may last only seconds, which makes it easy to ignore. However, repeated episodes suggest the brain is not receiving steady blood supply. This instability increases fall risk, especially during nighttime bathroom trips. Falls caused by dizziness often result in serious injuries after 60. Some people attribute this feeling to dehydration or medications alone. While those factors contribute, underlying artery blockages often play a major role. Walking more does not correct sudden blood pressure drops caused by poor vascular response. Doctors become concerned when dizziness occurs frequently or without clear triggers. This quiet symptom may indicate that artery blockages are already affecting brain circulation. Sign 6. Fatigue without clear reason. Fatigue without a clear reason is often blamed on poor sleep or aging, but it can reflect reduced blood flow limiting oxygen delivery throughout the body. After 60, arteries that narrow quietly reduce how efficiently oxygen reaches muscles, organs, and the brain. When tissues receive less oxygen, the body must work harder to perform basic daily activities. This creates a constant sense of low energy even after adequate rest. Many seniors describe feeling drained despite doing very little physical activity. This fatigue does not improve with naps or extra sleep. Walking daily may feel more exhausting than it once did. Poor circulation forces the heart to pump harder to compensate. That extra effort contributes to overall fatigue and reduced stamina. Blood flow limitations also affect how efficiently nutrients are delivered to cells. Without proper nourishment, energy production slows at the cellular level. Fatigue may worsen after meals or during mild exertion. This symptom is frequently dismissed until more serious signs appear. Doctors pay attention when unexplained fatigue persists over weeks or months. It can be an early indicator that artery blockages are affecting the body systemically. Signs 5. Shortness of breath with mild activity. Shortness of breath during mild activity is often attributed to aging or being out of shape, but it can signal restricted blood flow affecting heart and lung function. After 60, narrowed coronary or pulmonary arteries reduce the oxygen delivered during even light exertion. Simple tasks like climbing a few stairs or carrying groceries may suddenly feel exhausting. The heart must work harder to push blood through stiff, narrowed vessels. This extra strain increases breathing effort even when activity is minimal. Many seniors notice they need to stop and catch their breath more often. The sensation may appear gradually, making it easy to ignore at first. Shortness of breath often worsens during routine daily activities rather than intense exercise. Poor circulation limits oxygen delivery to working muscles. This creates an imbalance between oxygen demand and supply. Breathing becomes faster and shallower to compensate. Some people confuse this symptom with normal deconditioning. However, deconditioning does not typically cause sudden breathlessness with light activity. Doctors become concerned when shortness of breath appears without obvious lung disease. This silent sign may indicate that artery blockages are already affecting cardiovascular efficiency. Signs 4. Brain fog or slower thinking. Brain fog or slower thinking is often dismissed as normal aging, but it can signal reduced blood flow limiting oxygen and nutrients reaching the brain consistently. After 60, arteries supplying the brain may narrow quietly, affecting mental clarity before any major neurological event occurs. Many seniors notice difficulty concentrating, finding words, or processing information as quickly as before. These changes often appear subtle and fluctuate throughout the day. Poor circulation means brain cells receive less oxygen during moments of increased demand. This leads to slowed thinking rather than sudden memory loss. Brain fog may worsen after meals, during fatigue, or when standing for long periods. The brain is highly sensitive to even small drops in blood flow. Walking or exercise alone cannot fully compensate if arteries are already restricted. Reduced circulation also interferes with waste removal from brain tissue. This can contribute to mental cloudiness and reduced alertness. Many people blame stress or poor sleep without considering vascular causes. Doctors become concerned when cognitive slowing appears alongside other circulation symptoms. Brain fog may precede more serious issues like transient ischemic attacks. This quiet sign suggests artery blockages may already be affecting brain health. Signs 3. Poor wound healing. Poor wound healing is often overlooked, but it can be a strong signal that narrowed arteries are limiting blood flow needed for tissue repair. After 60, even small cuts or bruises may take noticeably longer to heal than they once did. This delay happens when oxygen and nutrients cannot reach injured tissue efficiently. Healthy circulation delivers immune cells that fight infection and support rebuilding. When arteries are narrowed, that delivery system slows down. Many seniors notice scabs lingering or wounds reopening easily. Feet and lower legs are especially vulnerable because circulation there is already weaker. This is not simply about thin skin or fragile aging tissue. It reflects inadequate blood supply reaching the repair site. Poor healing also increases infection risk, even from minor injuries. Some people attribute this to diabetes alone, but artery blockages play a major role. Walking more does not necessarily improve healing if vessels are restricted. Delayed healing can appear years before serious cardiovascular events. Doctors become concerned when wounds heal slowly without obvious infection. This quiet sign often indicates that circulation problems are already affecting the body's ability to recover. Signs 2. Chest pressure or tightness without pain. Chest pressure or tightness without sharp pain is one of the most dangerous warning signs because many seniors dismiss it as indigestion, stress, or muscle tension. Unlike dramatic chest pain, this sensation often feels like heaviness, squeezing, or fullness rather than stabbing discomfort. It may come and go, especially during mild activity or emotional stress. After 60, narrowed coronary arteries may limit blood flow without triggering classic pain signals. The heart muscle can become mildly starved of oxygen without producing severe pain. This creates pressure rather than sharp discomfort. Many seniors describe it as an uncomfortable awareness in the chest rather than pain. Because it does not feel urgent, it is often ignored. This is particularly dangerous because it can precede a heart attack. Chest tightness may also appear during exertion and ease with rest. That pattern strongly suggests a circulation issue rather than digestion. Some people feel it in the center of the chest, others across the upper chest. It may be accompanied by fatigue or shortness of breath. Doctors take non-painful chest pressure seriously in older adults. This silent sign often indicates significant artery blockages affecting the heart's blood supply. Signs 1. Sudden balance issues or near falls. Sudden balance problems or near falls are one of the most alarming signs because they often reflect impaired blood flow to the brain rather than simple clumsiness. After 60, even brief interruptions in brain circulation can disrupt balance, coordination, and spatial awareness. Many seniors experience moments where the room seems to tilt or their legs feel unreliable. These episodes may last only seconds, making them easy to dismiss. However, short-lived does not mean harmless. Reduced blood flow affects the brain areas responsible for balance and posture. Narrowed arteries cannot respond quickly enough to changes in position or movement. This creates instability during walking, turning, or standing up. Near falls are especially dangerous because they often occur without warning. They frequently happen at night or in low-light conditions. Poor circulation combined with aging reflexes increases fall risk dramatically. Falls are one of the leading causes of serious injury after 60. Many people blame these incidents on uneven floors or footwear. Doctors become concerned when balance issues appear alongside other circulation symptoms. This silent sign often signals advanced artery blockages requiring urgent attention. Artery blockages rarely announce themselves with dramatic pain or clear emergencies, especially in seniors who remain active and engaged in daily life. Instead, the body whispers warnings quietly, hoping you will notice before a crisis forces attention. Cold hands, leg heaviness, dizziness, fatigue, breathlessness, mental fog, slow healing, chest tightness, and balance issues are not random inconveniences. They are signals that blood flow may already be struggling where it matters most. After 60, the margin for ignoring these signs becomes much smaller. Arteries are stiffer, circulation is slower, and the body's ability to compensate is reduced. What once felt harmless can now carry serious consequences if left unaddressed. The most dangerous mistake is assuming these changes are simply normal aging. Aging explains vulnerability, but it does not explain neglect. The body still communicates clearly when something is wrong. Recognizing these signs early gives you time to act thoughtfully rather than react urgently. Early awareness allows for lifestyle adjustments, medical evaluation, and risk reduction before irreversible damage occurs. This is not about fear or panic. It is about respect for the messages your body is sending. Small changes made early can protect mobility, mental clarity, and independence for years to come. If even one of these signs felt familiar, that awareness alone is a powerful first step. I invite you to share in the comments how old you are and which sign stood out to you most. Your experience may help someone else recognize a warning they have been ignoring. Please consider sharing this video with a friend or loved one over 60. And if you want more clear, honest guidance for senior health, subscribe to the channel so we can continue learning how to listen, respond, and live stronger, longer.